In today's top stories, researchers are hopeful that cannabis may help sickle cell disease patients. People seeking medical cannabis in New Jersey can now get their recommendations online. And a new study suggests cannabis consumers think legal cannabis products are safer. It's Friday, August 14th, and this is your Trichomes Morning Buzz.
Broadcasting live from the Trichomes.com studios in Southern California. It's time for your Morning Buzz. We bring you late-breaking news that keeps you up to date with what's happening in the cannabis industry.
First today, a new study suggests that cannabis can reduce hospital visits among sickle cell disease patients. According to HCPLive.com, those with the condition who requested and obtained medical cannabis to treat pain were admitted to the hospital less frequently than those who did not. The findings suggested cannabis may be an effective resource in reducing pain at home for patients with sickle cell disease. Lead study author Dr. Susanna Curtis of Yale School of Medicine and Yale Cancer Center said, "We need controlled trials to look at each product and the effects of how it is taken so that we can offer regulated pharmaceutical-grade treatment options." Curtis and colleagues examined data from 50 patients with sickle cell disease at the Adult Sickle Cell Program at Yale New Haven Hospital. Patients were certified for medical cannabis use. Among certified patients, 29 obtained the cannabis and 21 did not. The primary study outcome was change in healthcare use and opioid dispensation. The team obtained data including the number of inpatient hospitalizations, number of emergency room visits not resulting in admission, and number of infusion center visits for pain crisis. A reason for reduced hospitalization rates could be because medical cannabis helped patients better tolerate their pain at home, Curtis suggested. The findings could lead to an alternative pain option for patients with sickle cell disease. The study, titled Medical Marijuana Certification for Patients with Sickle Cell Disease, a report of a single center experience, was published online in the journal Blood Advances.
Next, New Jersey just approved medical cannabis telemedicine, which could lead to an uptick in purchases. According to MJ Biz Daily, New Jersey health authorities recently gave the green light to physicians to write recommendations for medical cannabis through online appointments. The move could lead to a boost in the number of registered patients in the state. According to mHealth Intelligence, the permission came through the New Jersey Attorney General's Division of Consumer Affairs. The agency issued an administrative order expanding the guidelines under which telemedicine can be utilized by healthcare providers, so patients can avoid in-person doctor's visits and thereby minimize the prospects of being exposed to the coronavirus. One of the expanded telemedicine uses is for medical cannabis. Even if the order doesn't result in a significant uptick in the number of patients, it's likely to at least help existing patients renew their certification so they can continue to purchase. The order is temporary, however, and that will be lifted once the coronavirus pandemic has passed, whenever that is. New Jersey is somewhat late to the party on telemedicine. By May, at least 24 states had already granted similar permissions to their physicians to write medical cannabis recommendations after an online consultation. Better late than never.
And let's end the day with another study, this time about legal versus illicit cannabis. According to this research, cannabis consumers say legal products are safer and offer more convenience. According to Ganjapreneur, the majority of cannabis consumers, or 59%, said that legal cannabis was more convenient to buy, and 56% say it was safer to purchase than its illegal counterpart, according to a University of Waterloo School of Public Health study. The study examined consumer perceptions of legal versus illegal cannabis sources in Alaska, California, Colorado, Nevada, Oregon, and Washington State. 1 in 3 respondents said they believe legal cannabis was more expensive, and just slightly more said legal cannabis is higher quality than that from illicit sources. The study's authors note that consumer perceptions varied according to how long legal cannabis has been available in the state. Respondents living in more mature legal markets were likely to perceive legal cannabis as higher quality, the authors wrote. What do you think? Sound off in the comments on this article on Trichomes.com.
And that was today's Buzz. Thanks for listening. For more cannabis news and insights from industry professionals and a place to discuss these stories and others, visit Trichomes.com.
And don't forget to subscribe to the podcast and leave a review. You can also keep up with Trichomes on all social media platforms and the Trichomes YouTube channel. For Trichomes.com, I'm David Fortin.
And I'm Allison Ben Yehuda. Enjoy your weekend.